All right, welcome to Module 2. And let me share my screen here. All right. So this is a synthesis of Giddens Module 2. And remember, these are maternal concepts. So as LPNs, you guys skipped Nursing 108, which is Concepts 1, and Nursing 128, which is Concepts 2. In Nursing 128, Concepts 2, the students are introduced to the concept of family dynamics, reproduction, and sexuality. So I do want you guys to refer to your ATI book, which has need to know, concise version of everything you need to know about postpartum care. And you can also use all of that for your presentations as well and to write your 2-page APA paper. All right. So the concepts that we're going to be covering are concept of family dynamics, reproduction, and sexuality. Again, this is a synthesis of the most important information. So per chapter, per slide, there's going to be a question associated that you will need to answer on the Word document that you can upload to the Blackboard site. So this is your ticket to lab, along with the Claywell questions that you'll have. So besides covering these concepts in this module, I also want you to look at the NCLEX Maternal Child 2019, which I have that linked in the module. That's the material that you will need to know, and that's directly from the blueprint, which we covered last week in lab. So make sure you review that and you understand that. And we also have web links to all the material that you need to access for any maternal child information, such as the newborn care, antepartum care, intrapartum care, and postpartum care. The majority of the information is from the National Institute for Health. And then for simulation, we're going to assess fetal heart rate during a prenatal exam. We're going to work on our high fidelity simulator, which is Victoria. You will calculate the expected date of delivery and provide prenatal care and education with emphasis on the client's psychosocial response to pregnancy, such as their support system, perception of pregnancy, and coping mechanism, all in simulation this week. You will also present to each other in lab. So teaching on a specific assigned topic that was assigned to you, postpartum care and education, the newborn care specific to feeding with emphasis on breastfeeding, and introduction of the newborn to the family, infant safety with infant and child car seats, newborn nursing security, along with safe sleep, school safety and cultural differences, and childbearing. These are all important aspects that you have to understand for the NCLEX as part of your presentation. You will also write a 2-page paper, APA format, with at least 2 peer-reviewed resources. And I also have a template that's included, and you can just put your title in, fill in the blanks, and there's your presentation. So you do not need an abstract. You just need the 2-page written paper about your topic that was assigned last week. And then at the very end, we will take an NCLEX quiz focus on maternal child health. All right, so then we have the learning objectives here that you guys will cover as well. So we're going to have a short case study. Ann Jones, she's going to be a 17-year-old in labor. She's positive for Group B strep. And we will work on understanding the fetal heart rate, monitoring by reading some graphs. So you'll learn how to read graphs. And now we're going to transition to the first concept here, which is reproduction. So this definition is pretty plain and simple. There are groups at risk pregnant worldwide, which is the young adult population. Problems with this population can occur during pregnancy. It include depression, anemia, infection, social isolation, preeclampsia, protracted labor, premature birth, impaired nutrition, and C-sections as well. Individual risk factors during pregnancy include genetics, altered or mutated genes, inherited disorders such as sickle cell disease, cystic fibrosis, psychosocial issues such as smoking, drinking, drugs, spousal abuse. What else? Social demographic factors such as income, prenatal care, age. Trying to look at my notes here. When they're pregnant, race, ethnicity, whether they live in a rural or urban location, and if they're married. Environmental factors such as pollution, exposure to radiation, chemicals, drugs, prescriptions or over-the-counter, bacterial or viral infections, and a big one is stress as well. Now you have to understand primary prevention measures. An example is teaching high school students. So understanding primary, secondary, and tertiary prevention is important. So as for primary, as you're educating, you're promoting, activities such as safe sex, contraceptives, cessation of alcohol, drugs, smoking. Secondary prevention measures are always screening. So remember SS. That means that it is to detect diseases such as diabetes, cardiovascular disease, but it is also continuing prior prenatal care. In the second trimester of pregnancy, it's used to determine gestational age and decreased reproductive complications. There's a reference table in Giddens 21.2 that talks about the drugs used in pregnancy. And you might need that to understand that for your quiz and to prepare for the NCLEX as well. Okay, so let's go to the questions. So make sure you fill this out in the Word document. All right, and then we have sexuality. So the concept of sexuality, which the World Health Organization defines as the central aspect of human being throughout life, encompasses sex, gender identities and roles, sexual orientation, pleasure, intimacy, and reproduction. And then the Center for Disease Control, CDC, defines sexuality as the state of well-being in relation to sexuality across the lifespan that involves physical, emotional, mental, social, and spiritual dimensions. There are 4 interrelated sexual psychosocial factors, such as sexual identity, whether one is male or female based on biological sexual characteristics, gender identity, how one views one gender as masculine or feminine, and those are usually socially derived from experiences with family, friends, and society. And then there is sexual orientation, how one views oneself in terms of being emotionally, romantically, sexually, or affectionately towards an individual or a particular gender. And finally, the 4th interrelated one is psychosexual factor is sexual behavior, how one responds to sexual impulses and desire. Sexual well-being is an overall satisfaction with life, fulfillment, and positive functioning. Physiological factors that affect sexual health are cardiovascular disease, which affects our perfusion, right? Diabetes can cause neuropathy, respiratory issues can cause exercise intolerance, and neurological issues can cause damage and dysfunction. And then there's muscle diseases as well that can cause problems with range of motion. Psychosocial factors such as fear, anxiety, fatigue, fear of pregnancy, altered body image, and possibly abuse as a child. Other factors such as lack of social skills, lack of knowledge of sexuality, and changes related to aging. Environmental factors such as exposures to chemicals, social isolation, lack of a partner, lack of privacy, such as being in a long-term care facility, populations that are at risk for STIs or the young adults, sexually transmitted disease. Without proper protection and without proper education, this population is at risk. And then you have disabled individuals as well that have a disability, right? You will have to think of your patients as well. You know, do they have a disability that can impact their sexuality as well? Okay. Divorce, separation is huge as well. Sexual orientation such as gay, lesbian, and bisexual engage in more high-risk sexual practices. So that's important to know. Look at the box from Giddens 22-2 for medications. And then the next question here I have is on sexuality. So make sure you document this. All right, the next concept is the last concept. And this one is family dynamics. So family dynamics is defined as interrelationship between and among individual family members or the forces that work within a family, produce particular behaviors or symptoms. The dynamic may be positive or negative, supportive or destructive, nurturing or damaging. This dynamic influences how a person views the world outside their family. RNs must recognize risks, assess situations, and plan and deliver care appropriate to the situation. Some of those situations can be expanding families, such as through childbirth, adoption, or combined families, such as through marriage. Cancer or life-threatening diagnoses can also affect family dynamics. Intimate partner violence or an adult child who lives with a parent that's abusive, substance abuse and addiction can interfere with family dynamics, as well as death and dying. Knowing whether the family dynamics are positive or dysfunctional enables us as nurses to set goals, create a plan of care, and provide care while continually assessing the family. Next, we have the question 6 on family dynamics. There we go. And then these are your learning outcomes. Yep. That's the end of this module. Thank you.